Hey everybody, welcome to Doc Simple. I'm Doc Ben.
And I'm Doc Leo. Today we're going to talk about back pain. Hello, this is Leo.
Leo, it's Betty.
Hey Betty, what's up?
Leo, I don't know what to do.
Okay.
I was at the gym yesterday. I was doing some exercise. I felt a pop in my back.
Yeah.
I thought I was okay. I went home. A little sore, but no problem.
You were able to get home?
I was.
Okay, all right.
Drove myself and everything.
All right.
And I got out this morning. I could barely move. My back is killing me.
All right. And it's your lower back?
My low back.
On one side?
I don't know. It just kind of it hurts. Yeah, a little bit more on the right. Yeah.
And is it when you turn side to side that it hurts?
I can barely get out of bed.
Yeah, okay. All right. Have you peed or pooped on yourself?
What?
Have you peed or pooped on yourself?
No.
Have you lost feeling in your legs or in your groin?
No. What kind of questions are these?
Important ones.
All right.
All right. And do you have a fever?
No.
Did you fall or hit your back, or did someone hit you in the back?
No. Okay, well, some of those questions seemed a little silly, but they were important, as Doc Leo said. So let's talk about back pain. Signs and symptoms. So signs and symptoms of low back pain, generally, as Leo said, pain. Some of the pain can be dull and aching, sometimes a little stabbing, sharp, or electrical even.
Right.
Sometimes it can go down a leg.
Right.
Yeah. Anything else?
Typically triggered by rotation, bending, or movement. It can happen at rest also, but it's usually exacerbated by some movement.
Got it.
And in most cases, people can trace back a story of something that happened, whether they were helping a neighbor move or lifting a heavy box at work or
a low-speed car accident.
Right. So in most cases, something along those lines is going to fit into a story. We'd like to have a good story to explain where this is coming from.
Right. Okay, that was signs and symptoms. Could we talk about treatment?
Sure. Let's talk about treatment. So rest, lay down, find a comfortable spot on the couch. Don't move for about 2 to 3 days. None of that?
No.
All right.
Believe it or not, the research shows that we should be doing movement as tolerated, meaning keep the muscles kind of moving, within reason, of course. Laying flat for a prolonged period of time is your enemy. You'll stiffen up, make things worse.
Okay. All right. Let's see. Do we take some medicine? Do we do some warm compresses? Do we maybe use some of those patches that everyone's trying to hawk on TV?
Yeah.
Any of that?
Yeah. I can't use those names, but like something like a very cold or a very hot pack in the same thing, maybe.
All right.
All right. Here's the deal. Medications, in general, not terribly successful at controlling low back pain, especially prescription medications. Now, over-the-counter anti-inflammatories, ibuprofen, naproxen, those can actually help.
Right. Yeah, and as well as some warm compresses to the area and gentle movement or constantly throughout the day, getting up and moving around and triggering those muscles to get activated will help to heal them a little bit faster.
Yes, and then actually online you search low back exercises. Those can be really helpful, especially when you're not in pain to keep everything stretched. But then even when you are in pain, gentle exercising is okay.
Exactly.
I want to make one comment, Leo. This is a very commonly practiced sleeping habit that actually makes things a lot worse, and that's sleeping on your stomach. The bottom line is sleeping on your stomach, never. Don't do it. Okay, that covered treatment. Let's talk about prognosis.
All right, back pain lasts for somewhere between several hours to forever.
Okay, so several hours to days, sometimes even weeks, of course, is dependent on the extent of the injury, your history, meaning have you had injuries before. The majority of low back pains are self-limited and they will go away on their own within a handful of days.
Yeah.
Okay, now let's move on to who to call, where to go. The good news is, as we said, most of this stuff can be managed at home.
I will say one thing about so with muscle relaxers as well as the stronger narcotic medications and steroids, which are the three classes of medications we tend to use in the emergency setting for lower back pain. Almost universally, all studies have shown no significant improvement in progression and improvement, and these, especially the muscle relaxers and the narcotics, just tend to make you sleepy and thus sort of not aware of the pain that you're feeling.
Okay, thank you for that.
Sure.
The end of the scale there is, of course, the emergency room. So let's go to our next section. Oh no.
Oh, I love this.
The features that would make an emergency room doctor concerned, or things that should prompt an ER visit.
Yeah. The things that make me sweat when I'm talking to a patient and that I hear them tell me are inability to control your urine or your bowels.
Oh, that's why you asked Betty.
I did ask Betty that, yeah. Okay. And or inability to sense your groin area. That would be concerning.
Your groin.
Your groin. So that you lose feeling in that region.
So you're saying numbness kind of in between my legs.
Correct. Where the horse touches. Now, other things that would make us concerned would be a story that involves some level of breaking the skin or putting some instruments in around your back, like injections or recent surgeries, or if you inject IV drugs, and we'd be concerned about a correlated fever or increased swelling in that area.
Okay, so you just said fever, people who use needles or just had a surgery, especially in that area, numbness, tingling in the saddle area or groin, pee or poop issues.
Right. And finally, loss of function. So if you have inability to move your legs or feel your legs, that would also be a significant concern. I think that sums up the general picture of the oh no's that we think about in the emergency room.
Okay, that sounds good. Hope you don't get back pain today. I'm Doc Ben.
And I'm Doc Leo.
Thanks for listening to Doc Simple. See you next time. Bring, 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 bring. Bring, 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 bring. You know what that's called?
Unless the horse touches you in other places.
It's increased stress. Don't sleep on your back. Sorry, stomach. Don't sleep on your stomach.
Hot and cold together.
Yeah.
Sounds like the plot line to Frozen 3.
Ooh. Fall from a 10-foot ladder.
Right.
Getting dropped kicked by a professional wrestler. Maybe I should call a different doctor.
Betty?
Yeah.
What's going on with your voice?
It's a guy's name. It's okay. Don't be a hater.
Okay. And, where you fall in that is your personal problem.